How is a biopsy performed for adult osteosarcoma? When doctors suspect adult osteosarcoma, they need to confirm the diagnosis by taking a small tissue sample from the tumor. This process is called a biopsy and is a key step in planning treatment. There are two main types of biopsies used for this purpose. The first is a core needle biopsy, where a thin hollow needle is inserted through the skin into the tumor. This needle removes small pieces of tissue, often guided by imaging techniques like computed tomography scans or ultrasound to ensure accuracy, especially if the tumor is deep inside the bone. Multiple samples may be taken to make sure enough tissue is collected for a proper diagnosis. This method is less invasive and can usually be done under local anesthesia, meaning the patient stays awake but the area is numbed. The second type is an open or surgical biopsy. In this procedure, a surgeon makes an incision through the skin to directly access the tumor. They remove a larger piece of tissue for examination. This approach is more invasive and typically performed in an operating room under general anesthesia, where the patient is completely asleep, or sometimes with regional nerve blocks that numb the area. The advantage of an open biopsy is that it provides a bigger sample, which can help in more detailed analysis. Performing a biopsy for osteosarcoma requires careful planning by an experienced surgeon. It is crucial that the biopsy is done correctly to avoid spreading cancer cells to nearby tissues, which could make future surgeries more difficult. The incision for the biopsy should be planned to match the incision that will be used for tumor removal later. This way, the biopsy tract can be removed during the final surgery, reducing the risk of leaving behind any cancer cells. Before the biopsy, doctors will perform imaging studies like X-rays, magnetic resonance imaging scans, or positron emission tomography scans to understand the tumor size and location, and to check if the cancer has spread elsewhere. After the tissue is collected, a pathologist examines it under a microscope to confirm if it is osteosarcoma, determine how aggressive the tumor is, and help guide treatment options. In summary, a biopsy for adult osteosarcoma is a carefully planned procedure performed by specialized surgeons. It involves collecting tissue samples in a way that minimizes risks and preserves options for effective treatment, including limb-sparing surgery. This step is essential in diagnosing bone cancer accurately and planning the best approach for each patient. Always remember, if you or someone you know is facing this, consulting a healthcare professional is the most important step to get personalized and safe care.